Welcome back to Plant and Animal Diseases class, and the final unit of this course is Unit 17, which is going to cover quickly vaccinations and immunization protocol. So let's jump into some content and talk about how we might prevent some of the diseases that we've talked about prior. When we talk vaccination, it is a mechanical act of administering a vaccine for the purpose of developing immunity in an animal. And again, very technical definition there, but essentially what we are attempting to do is inject the animal with a little bit of the disease-causing agent that's been altered in the laboratory in a way that the animal will produce its own antibodies against that specific disease, and therefore then be able to fight it off in the future. The amount that the immunity developed sometimes depends on a number of things here. First off, whenever we vaccinate animals, we should hope that they are in good states of health already. Good, healthy animals respond better to vaccinations instead of get stressed by it. So you want to make sure that in most cases, it's best to make sure you're vaccinating already fully healthy animals, preventing a disease. Vaccines don't work very good whenever you are treating an animal that's already stressed or already has the disease you're vaccinating for. It's not an antibiotic, and it doesn't work in that way. So make sure that you're careful in selecting when you vaccinate an animal. Next is the condition of the vaccine. Vaccines are very finicky substances, and you have to make sure and handle them correctly, stored at the right temperature, keep them out of the sunlight sometimes. So make sure that you have proper handling techniques of the vaccine. And then the manner in which it is that's supposed to say injected here, the manner in which the vaccine is injected certainly has some play in how much the immunity is developed. Don't forget that immunity is a relative term. Even when you vaccinate, an animal can become ill and get the sickness that you're trying to vaccinate against if they are simply overcome by a massive exposure to pathogen invasions. So even sometimes whenever you do your best to prevent the disease, it can come back around even if with mass. It's not the final answer. Just because you vaccinate doesn't mean that you're going to prevent all disease. It has to be combined with the three things that are listed here, and that's just a very brief list. You've got to have really good nutrition. You have to reduce stress on animals. You have to make sure that you have proper sanitation on the farm. And if you don't, then vaccination is simply a Band-Aid or a hope you hope that will help you. You don't know that it will. So make sure that you combine vaccination investments with a number of other things on your farm so that you'll get maximal response, because it is an added input cost. When we look then how physiologically do vaccines work, we got to look at the antigen-antibody reaction. So after we inject the vaccine, it stimulates the formation of those immune bodies or antibodies against the specific disease. And sometimes you'll see an accompanying sign of poor health. For example, if some of you have ever gotten flu shots before and then the next day or so you feel kind of ugly, or you feel kind of down, or you feel kind of stressed, and you break with maybe a low-grade fever, that's essentially some mild symptomology of the flu breaking through on you as a result of the flu shot injection. What's happening physiologically inside your body, though, is your body is making antibodies against said flu virus. So that's a sign that it's actually working for you. Will it stress them for a few days? For sure. That's why it's oftentimes recommended that we don't bundle different things with our animals. For example, we don't bundle vaccinations at the same time as castrations and dehorning and things of that nature, because sometimes those compound stressors will cause outbreaks of some of the diseases we're trying to. It can actually produce the disease in rare cases. So understand that may actually happen. And if you've heard people talk about, I got a flu shot and then I immediately got the flu, sometimes that actually does occur, though it's quite rare. And then lastly, immune response depends on the type of vaccination given, and MLV stands for Modified Live Virus vaccination. So essentially what we're taking is the live virus, we modify it in the laboratory, and then inject it back into the animal. What that does is that oftentimes creates a much quicker and much higher response in antibody numbers to that specific virus. Now you have to be careful using modified lives because many times you cannot use them on pregnant animals. So you have to be very careful on how those are handled. In addition, make sure that you store, mix, inject with clean needles, use proper procedure when using modified lives because they are also very, very finicky when it comes to how they're handled and so forth. Killed vaccines are that same virus that's been taken into the laboratory, killed so that it can't actually produce the produce the sickness, and then it's regenerated many times over in laboratory setting, and then we inject it. And what this does, just by the simple larger numbers of injections that we give, more cc's or more milligrams, whatever it may be, you'll get an immune response that way. So those two are there, and make sure that you consult with your veterinarian whenever considering vaccinations, whether you should use a modified live or a killed vaccine. Antibody buildup is a normal reaction to infection. So anytime that you get any kind of viral or bacterial infection, your body builds up some level of antibody titers against that disease. So that is a normal reaction. Also, we want to help keep disease-causing organisms from the normal infectious course. We want to try and break that cycle down. Then lastly, depending on which virus vaccine that you're using, it may be required to use a booster shot to supplement or maintain antibody levels in there, whether it's a killed vaccine. Oftentimes killed vaccines need a booster shot along the way because they simply wear off. Modified lives, it just depends on which one that you're using. Sometimes those do and sometimes they do not need booster shots in order to help keep antibody levels high. So make sure, again, consult with your veterinarian whenever selecting those products. Next slide here, when we talk about immunity, the first one and actually the best way to get an animal to have high levels of immunity is just simple natural immunity, that protection that an animal has when it's born. Really not associated with antibodies in the body fluids. So we have some species resistance, we have some breed resistance things. For example, milk fever, more prevalent sometimes in Holsteins than Jerseys, or more prevalent in Jerseys than Brown Swiss, and so on and so forth. So we have a little bit of. And then next we have some individual resistance. Sometimes some individuals just genetically have a higher immune response to be able to overcome disease outbreaks easier. Next is what we call acquired immunity, so associated with some kind of presence of antibodies from another immune animal in the form of exposure to the disease. So we can have active immunity, so direct contact with a disease-causing organism. So they have a calf exposed to a particular disease-causing agent, and they don't necessarily outbreak with the disease. They start to develop these antibody titers against that specific disease. Some of those things do develop after they do have an active infection. So let's say, for example, that we move some calves onto our farm and they outbreak with a respiratory disease, a shipping fever, so to speak. Well, once they overcome that disease, they're going to develop antibodies against that disease for future reference. In addition, if we vaccinate them, they will even develop more antibodies against that disease. Again, remember, that doesn't necessarily preclude them from getting the disease in the future if they are simply overcome by massive exposure. Again, a lot of this is relatively long-lived and often lifelong in terms of active resistance. Next is what we call passive immunity, so transferring antibodies from one immunized animal to a susceptible animal. So again, think of colostrum immunity, where animals have the ability to absorb antibodies from colostrum within about the first 24 hours after birth. And there are lots of tests available to test immunoglobulin content in your colostrum, and I would stress to you, if you're having issues with young stock after birth that just are unthrifty, they don't take off right away, it might warrant testing your colostrum to see if you've got antibody levels that are too low. And then find a way, work with your veterinarian again, find a way to improve immune response there. Don't forget when we talk about colostrum handling here with respect to young stock is we want to make sure that those young stock get colostrum and as much as they can consume as soon as possible after birth. And I'm talking within the first 3 hours, really. Keep in mind within the first 6 hours, their ability to absorb those great big proteins drops by about half. By 12 hours, it drops by half again. After you get past 24 hours, that animal has very little possibility of actually absorbing very many of those immunoglobulins anyway. So if they've not had their first colostrum feeding until, let's say, 30 hours after birth, they're probably going to be very, very susceptible to a lot of diseases. Biologic agents, organisms that we prepare them so that they can be safely given to livestock, and then those livestock carry that protection with them. I mentioned modified live viruses or MLVs earlier. Again, we grow them in the lab or another animal, and we'll stimulate antibody function that way. Generally given in pretty low doses, sometimes just a couple to maybe 5 cc's max. But you generally get a pretty high immune response. Again, do not give these to pregnant cattle. They will good chance that they will abort, and if they don't abort, you got killed viruses. Again, that pathogen, like I said, is killed. We produce it in a suspension in the laboratory, and relative to MLVs, these are given in a really high dose, much more safe for pregnant cattle and should not cause animals to abort. But again, as we discussed earlier, you'll more than likely have to give them a booster shot. So some types of immunizing agents that are there. We have some viral vaccines that have to be propagated in living cells, either grown from tissue culture in a host or non-host animal. And there's also bacterial vaccines that are there that the high doses are required to elicit immune response. So we grow that bacteria in artificial medium and usually give it in a killed form. When you vaccinate animals, some things that you need to know: make sure that you have a good, clean, good quality syringe, sharp and sterile needles and sterile technique, and then be able to restrain the animal effectively. Technically, by the book, you should change needles after every injection. Now, that being said, I know that there are many producers out there that use one needle for the entire vaccination protocol that day. One of the things that I will tell you to definitely guard against is do not use a dirty needle. Use a clean needle and a clean syringe when going in and using a vaccine. If there's any antibiotic residue left in a syringe or a needle or both, and you drop a vaccine in there, guess what? You just killed your vaccine because that antibiotic residue in there actually fights against what you are providing them. So stay away from using dirty needles, already prior used needles and used syringes, especially for vaccinating. It just makes no sense to do that. When we talk sterile technique, make sure that the animal is clean and you're injecting in a clean area as you go, most of the time subcutaneous or IM. Use good sterile technique, and that will be helped and aided by good animal restraint, whether it's a squeeze chute of some kind or tying that animal up and getting yourself some help, because obviously they're not going to stand still for this most of the time. Don't use chemical disinfectants when using syringes and things of that nature either. So, for example, if you use the same syringe, but you say, I want to use good aseptic technique, so I'll get myself some iodine or some Novosan or something like that, and I'll clean my syringe after every injection, but not change the needle and not change the syringe. Well, that disinfectant will kill your vaccine. It inactivates it. So make sure that you do not use something like that, because you're probably going to deactivate your vaccine, and then you could shoot it on the floor, and it does the same thing. Follow all the administration instructions. Know what you should be doing. If you're going to inject subdermal or subcutaneous, intramuscular, if it's all given in one place or split in multiple sites, make sure and consult with your veterinarian and follow the directions on the label. Again, like I said earlier, avoid vaccinating sick animals. They're already stressed. It may cause a disease outbreak of the particular disease that you're trying to vaccinate against, or it may cause the outbreak of another pathogen just due to stress load. So be careful when vaccinating sick animals. Proper care of the biologics that we're considering here. Again, we talked about make sure that you keep these things free from contaminants and don't reuse needles and store them properly. Any partially used containers, discard them if you're not going to use it for a while. What will happen is that most of the time these vaccines are only good for a certain period of time, and especially once you've opened or already drawn injections out of the bottle, then we run the risk of contaminating it and making what's left in the bottle basically useless anyway. So discard those containers if they're only partially used. And I know you say, wow, that really drives up my cost. Yes, it does. So plan your vaccination protocols carefully so that you hopefully can use all the injections that are in the bottle. Keep those things refrigerated. Most of them like to be refrigerated. Again, follow directions carefully and monitor your drug refrigerator so that it maintains the proper temperature as prescribed on the label. If you have an empty modified live virus container, you should actually burn that. It's not really safe or recommended to throw it in the garbage because if something gets into it, you could have a problem that way. Understand that if you use vaccines after the expiration date, they may still work, but it may not work to full strength, and some are not recommended for use at all. So keep an understanding of expiration dates. And then especially once you mix, there are many modified lives that you have to mix two agents together. Once you mix them, lots of times those should be used within 2 hours or they don't work from a potency. Most, again, are sensitive to light and heat, so one of the things that you do not want to do if you go to the vet's office and buy a vaccine is throw it in the dashboard of the pickup truck. That bottle rolling around up there in the dashboard on a nice warm sunny day can actually kill all the vaccination off, or kill all the pathogens that have been altered off, so again rendering your vaccine useless. So make sure that you store these things properly, and again, anytime that you have questions when investing in something like this, consult your veterinarian. Take-home messages. Again, make sure that you understand differences in effectiveness of vaccine options. Always, always, always use the relationship that you have with your farm veterinarian. Consult with him or her what challenges that you have on the farm so that you properly select vaccines that will work effectively for your species. Then, again, make proper selections. Match the disease pressure on your farm. There are instances, by the way, especially when you get into larger operations, you can culture diseases on your farm and actually have vaccines made specifically for diseases that you have on your operation. That's actually fairly common in the swine business. They will culture diseases that they have going through their barns, take them to the laboratory, alter them, make their own vaccines that are native to their own operation. Because many times an off-the-shelf vaccine doesn't necessarily work for the bugs that they have on their specific operation. Think, for example, some of you that have gotten, again, flu shots before and then still had an outbreak of the flu. It may be a completely different strain of the flu than those that you were vaccinated against. Lastly, and probably the best idea, is write a specific plan, use it, and then evaluate it with your veterinarian. If you just kind of, willy-nilly, so to speak, select vaccinations, administer them, and then stand back and watch and see what happens, and then don't record whether it worked or not, it will be very difficult to tell if that investment was worth it. So write a plan, execute the plan, and then in consultation with your veterinarian, decide if that was the right one or not, and then make adjustments. If you need to use a different vaccine as recommended by your vet, then use a different vaccine. If your calves aren't responding or your pigs aren't responding appropriately, then vaccinate with something else. There are many different good products out there. So make sure that you are selecting one that's appropriate for your farm. So that's it for the final unit of plant and animal diseases. I certainly hope that our little lecture today will help you be successful on the assessment. I'll look forward to seeing you around. Good luck.